Hello, my name is John Faulkner, and I'm the host of the Smarter Systems, Better Care podcast. And I'm here today with Dr. Saeed. He is transforming healthcare loyalty and patient experience. He is the founder and CEO of Amenities Health, and he's bringing today his bold ideas at the intersection of medicine, technology, and innovation. Thank you for joining us today, Dr. Saeed. How are you?
I'm doing great. Thanks for having me.
You're welcome. So we'll just jump right into it. Can you share a bit about your role and how it fits into the bigger picture at your company?
Sure. So I'm the founder and CEO of Amenities Health. So in that function, I'm obviously responsible for kind of the entire company, but really mostly the vision. Fundraising is we're a health technology startup, venture backed, and recruiting as we build our team. So I really think that that first one's really the primary one because it kind of cascades into the next two. Recruiting and fundraising is all about what's your vision for the company, and then eventually the track record as we get a little bit older.
Yeah, absolutely. And then for those that are not like in that leadership role, such as yourself, what does a day to day look like for you? Like, what are you doing in the morning typically? I know it varies possibly a lot, but I just want to give people an
Yeah,
idea.
it definitely varies. I think it varies a lot because we're a younger startup still. So my days are often, kind of between those tasks. So I think part of the time I am figuring out operations that are, being to be built and, which states do we have to have providers licensed in and I mean, very kind of mechanically operational things. Then I'll jump over to either investor, board, or fundraising kind of efforts, which is a different world of
Yeah.
like how am I communicating with either advisors or board members about various things, employee equity, like kind of very, again, minutia of a company. And then I think the biggest, most important thing though always is about speaking with potential partner healthcare systems, and we'll talk about our model, but really put a giant focus on that. So a lot of that is just outreach and trying to, frankly, learn how to be a better salesperson. I think we've had different stages where we've been in exclusively founder-led sales, and then we had some expertise in that. And now we're back to more my focus, and it's always something I can improve on, and it's definitely not something that comes super naturally. So I definitely spend a lot of time on the mechanics as well as the kind of psychology of sales and other things.
Excellent. Thank you for sharing that. And then as far as like looking at your current state of the business, like what's working well for you right now and like what's been frustrating, the opposite end of that.
Yeah, I think the thing that's working that I'm incredibly proud of is I think we have a value proposition that is very unique in the market. I think one of the things that it's always odd to explain to people is like when you work with large healthcare systems, sometimes it feels like they're trying to actively avoid trying to do anything new. I mean, I think every kind of bureaucratic legacy industry has its own kind of inertia, but healthcare seems to be incredibly like rampant with that like, oh, we're so busy, we have so many meetings, we really got to figure out how we're going to make up all these budget shortfalls. Oh, you have an idea? Yeah, sorry, we can't meet for 3 months. It's so important. It's so busy right now. And then you ask yourself like, well, what's happening? What's changing in healthcare? And almost nothing does. And so it's I think that's having something that is very unique and first time. I was just at the American Hospital Association conference this last weekend in Nashville, and it was fun to hear. This is a little self-serving, but it's a podcast about me today. So it was fun to hear though that people, it was us and like a number of other sponsors went up and presented on their innovation one. At least for me, I was just like, wow, they do revenue cycle and they do every part of it, and they're a 50-year-old company. I'm like, that's fine. And obviously the world has plenty of those companies. But when we sat down with one of them and told him what we did, we're like, we were so excited to talk with you because we just haven't heard what you do before. And it's different. And we need to be thinking about this. And a lot of them, especially transparently, would be like, this is not on our radar. We're not even thinking about the premium healthcare market. And it's really interesting what you guys do and how the partnership works. So that's not always a home run, but at least it's something different and unique that they haven't heard before. Which again, I will talk a little bit of my background. I've been on the other side. I was responsible for innovation in a large healthcare system, and yeah, it's just the things that come across your desk aren't frankly that innovative or new or different. I mean, everybody's kind of like, did you know that mental health patients have, 4 times the cost of a regular patient and we help because we do. And I'm like, yeah, there's 50 other companies that do that. And especially now when you have, AI rampant in every model, it's like, oh, we take AI and we synthesize all this information. I'm pretty sure everybody's saying the same thing on that regard. So I feel good that we are very differentiated. We'll get into that. And then what frustrates me is though that there's not really a lot of urgency in the industry, and I wish there was more to try to change the trajectory of a lot of things. And part of what I mentioned earlier is we're trying to figure out like how do we create that urgency? How do we get people to recognize like there's a massive opportunity that they're foregoing here, as opposed to like I think often in healthcare there's like this promise of like, oh, we're a technology that'll help you save all this money, and transparently nothing saves any money because nobody's trying to save money. So they all say they need to, but that's just kind of headlines for the papers. But like nobody's actually trying to save any money. So
Yeah. What? And then, like in your messaging, it sounds like you're resonating with hospitals and things they never thought of before. Like, what are they saying to that? Like, they want to work with you. What's like speaking to them in your conversation that like is getting them to start thinking about it?
sure. Yeah, so maybe a little bit of context of what Amenities does and why I think it's different. Part of there's a couple of like foundational truths or first principles, I think a lot of people call them in my worldview and my experience in healthcare. So, I'm a physician, but non-practicing, um, public policy, so a lot of healthcare policy background, and then a McKinsey consultant working with healthcare systems, and then a or a health system executive. And for me, the things that I learned that maybe are not public knowledge is that like one that the majority of care is going to go through large healthcare systems. 40 cents out of every dollar spent on healthcare ends up at a large healthcare provider. And those healthcare systems, as much as they may pay lip service to it, don't really do a lot when it comes to patient experience. They don't believe that that dictates how much volume they get or not. When you ask them their strategy, everybody's strategy includes something around we need to increase the volume of commercially insured patients, meaning Blue Cross Blue Shield, meaning not Medicare, Medicaid, and other. And that's because those commercially insured patients subsidize the rest, and that is only going to continue to get worse and lopsided. But when you ask them, how are you going to do that? How are you going to increase commercial market share? They say that it's always the same. It's like it's basically red wine, red steak, wine and dine doctors talk about quality, say we're good quality, never define quality, keep saying we're better quality, and try to basically get people to understand why. Or I mean, one thing they don't often put in the strategy, but then is just like we need to merge with another health system or buy them so we can reduce costs. But again, that's imaginary. It's really for market power, so we can say we can increase the prices that we're charging to Blue Cross Blue Shield because now we have twice the number of providers. So everything's a pricing game, unfortunately. I don't think anybody's out there being like, how do we attract more patients because we do better work than our competitors? It's just like one of the least naturally competitive industries I've ever encountered. I mean, sometimes when you actually ask health systems, who's your main competitor, they'll list them and then say, how do you feel about them? They're like, they're trying to do good too. And when you're like, wait a minute, you desperately need commercial volume. Where do you think it's going to come from? Like it's not every market's growing. You're going to have to take it from somebody, and they just kind of don't seem to acknowledge that or what it would take to take it from them. Meaning, why would you get it and attract it? There's again, unfortunately, I think there's complete lack of like belief that patients have their own kind of decision making capabilities. Everybody just kind of assumes, well, you're going to go where a doctor sends you, and so let's go talk to those doctors. Sorry, so I was rambling a bit there. Healthcare systems will do the majority of care. Healthcare systems don't really believe that patients have autonomy to make decisions, and patients are worth a small fortune, like the highest lifetime value of any customer in any industry that I can think of. I mean, you and I will have somebody, whether it's government or our employer or insurance companies, spend probably $500,000 to $1 million on us, on our healthcare over our lifespan. And yet these healthcare systems are just completely disconnected about building loyalty, really. So I think that somebody's going to come in and materially shake that up. And so what Amenities does is we help healthcare systems build a premium experience. And when I say premium, yes, that means out of pocket extra in the amount in the market where people are paying extra, whether it's concierge care, advanced diagnostics, even wearables like Aura rings and other things. Like people are spending a ton of money on healthcare on the top end of the market, and health systems aren't participating in this, whether they think that they shouldn't or it's not fair or equitable. It doesn't matter. The funny thing is, I just looked up these numbers recently. There's an estimated about $32 billion shortfall in 2026 that is going to be attributed to the big beautiful bill cutting a lot of Medicaid spending to these
Wow.
health systems.
Yeah.
And ironically, it's almost exactly how large the concierge market is projected to be. The solution to me is like slapping them in the face is like, you need to build a different business than you have today and they're just like not head in the sand. And that's what I meant when I said like some health systems like, no, we've never considered the premium concierge market. Like they might have one or two concierge docs, but we want to help them really enter the premium market in an effort to help salvage their business and to subsidize all of this other care that they're going to be required to do and we need them to do and that they will end up doing regardless. They just need to make other money in other places to do so. And we think that hopefully, not just for the premium market, but that actually building that muscle of caring about attracting patients on their own volition will translate to everything getting better. All patients will get better experiences. Because I think that's what we have today is a lot of like good enough healthcare. Like, oh, we have this app. You can't, it's not really great, but it's good enough. It's good enough. Let's, like, what are you going to do? I mean, we're going to replace this whole app for you and spend $20 million. That's good enough. Like, good luck with it, John. You'll get to use it, kind of thing. So that's what we're trying to fix is changing the dynamics in healthcare by getting health systems excited about premium services, experience, and offerings.
Yeah. And that's a very novel idea, but it seems like so simple, but yet they haven't embraced it. They haven't
They
seen the
haven't embraced
value
it,
in
and
it.
it's nowhere to be found. I
Everything's
mean,
transactional.
right? If we ask like, where's the best healthcare in the country? Nobody's saying. I mean, you might be like, hey, if I have cancer, I'm going to Dana Farber in Boston or Duke or somewhere or MD Anderson. But like, I don't think anybody's like, hey, I want the best healthcare experience. I'm going to MD. No, you're going to sit and wait. Like that's what you're expecting, and that's really a shame.
Yeah, it is a shame. And thank you for sharing the insight and the data too. That's very telling too. I did not know those numbers, so thank you for sharing that. And as far as like industry trends, like what major shifts are you seeing in the industry now, or if anything, that's moving in a positive direction? Is there anything that comes to mind?
Yeah, I mean, definitely one thing that is a very pleasant surprise because it felt like for a long time we'd never get here is some meaningful interoperability to where you don't have to have the EMR that the health system does. I'll give you a brief history of this. Like there was for a while, like a decade ago, we started with like when there was some electronic medical records. People were like, okay, well, how do we get these things to talk to each other? And there was this idea of data exchanges or health information exchanges, HIEs. And that was just silly. It ended up in hindsight being super silly, even though people spent tens of millions of dollars on these because they would download all this data from disparate medical record systems, but none of them were actually standardized in any sort of format. They were never pushed back in real time, and almost no one looked at any of it. Like that was the funny thing. Like, okay, great, you can exchange information, but how much are you actually doing it? And then, the part of the Affordable Care Act, what it did in 2008 was it looked for these no lose investments. And there's a great book, The Digital Doctor by Dr. Robert Wachter, who spoke about this. Is where I learned it. But from 2008 to 2018, we went from less than 1 in 10 hospitals having a medical record to less than 1 in 10 don't. I mean, it was this massive digitization of an industry, but we're healthcare. We don't like what we did is we took a bunch of doctors who don't know how to type and said, okay, now you have to use medical records, EMRs. And so all of a sudden we had this new job that cost money called scribe. So like we didn't exactly figure out how to use these things really well. And then I would say since 2018, it took us a long time, but now we're at a place where there are meaningful exchanges of health systems. So first it was like if you had Epic, then Epic would brag about how there was care everywhere, which is every Epic instance you can see the other Epic
Yeah,
records. And
connected
that's
to each other. Right.
yeah, exactly. And that's pretty meaningful in the sense that like in Dallas Fort Worth, every major health system has Epic. So you could tell if somebody was admitted to a hospital somewhere else. But not every outpatient did, of course.
No.
So what's really nice is that now there are these networks called Care Everywhere, or sorry, Care Quality Alliance, and then also the Care Equality. And so now if you have other major EMRs, those also share bidirectionally with Epic. And the thing that really relieved that why I'm saying that's progress is I think prior to that, basically every health system is like, we're going to spend a small fortune rolling out Epic everywhere, but if you don't interact with Epic, sorry, we can't use you, can't innovate. And so basically it was like, well, innovation only goes through this one system, but it's not innovating at a pace that anybody's like thrilled with. And so
Yeah.
what does that leave us? But now I think with this interoperability, I think people are kind of over that mental model and saying, hey, we can start to actually have progress made with systems that are on different ones because we can see the records and that's good enough. That's what we were all saying was the right way to do this anyway. So that's been a fantastic, I think, evolution in the last few years that I didn't know if it would ever really materialize. And the fact that it has and that people are thinking of it that way is actually pretty great.
Yeah. And I saw that shit firsthand. That's because I started in 2012, and that's exactly what happened. It was like a very small percentage using, the EHR, and then it just skyrocketed in about a 6 8 year period. So it was an amazing
And it was
trans.
interesting when you think about that transition, it was like all the focus was on getting live. I mean, even now we have health systems that are kind of in their second phase
Mhm.
of like, okay, we have digitized the EMRs, but we didn't pick the right one, and now we're moving our entire set. And the funny thing is, when you're moving EMRs, nothing else happens.
Yeah,
Like that's the troubling thing is they take so much focus, and I think we still are a ways off from the promise of EMRs being productivity tools as opposed to like billing refinement opportunities. But we could spend an hour on that gripe, I'm sure.
for sure, absolutely. And then what has going along that trend, like that you've seen, like how's it like impacted your business or your growth strategy? You know,
Yeah, I think for us, we've had a meaningful. So again, I mentioned kind of briefly that I came from a large healthcare systems. Prior, I led innovation at Baylor Scott and White Health here in Dallas, and it very much was an Epic-centric strategy. And so a lot of our background, especially as I launched into amenities in late 21, was to be very integratable. And what that meant was a lot of man hours, a lot of intensive integration, and a lot of resources on the health system side as well. And I think now that again that reality has matured a bit with interoperability, TEFCA, QHINs, all this other stuff that's happening in the industry, that hopefully that can actually curtail the need for an intensive, activation energy to get live with something, as long as everybody's pretty reasonable that like it doesn't have to be on one system if those systems can talk to each other. I think we're just at the beginning of that shift. At first, I think the last 5 to 10 years, the idea was, okay, the only way this is ever going to work is if everything is one system. And not surprisingly, those one systems that were vying for that one system spot agreed with that worldview and basically said, like, yeah, every other system's terrible, use ours. But I think everybody who's realistic is like, the world's not going to be on one system ever. Can we build some meaningful interoperability? And enough of them participated. And again, the leaders participated as well. I think I've been pleasantly surprised. We're almost there to where now I think the mindset shift has to follow it to say, okay, it doesn't have to all be on one system. As long as we're meaningfully sharing information, then let's do that. Let's try stuff faster rather than saying everything, because that's just not an option for a lot of models, frankly, to have everything on either Epic or Oracle Cerner or Meditech or whatever it is. It's just not a reality. So
yeah, it may not be financially a good decision for them. It might be like why to them, why break something that's already working really well? Like it needs to be like a very convincing argument to go to the one system. And yeah, I've seen that as well through my consulting. Is like the model like 10 years ago, like when they started going live, is just let's just go to Epic,
I'll
and
give you
now it's yeah,
another example. Like, there's two big things. One is like there's certain innovation that's moving at a pace that like the big players won't even sell to that market, right? Like those are all hospital inpatient EMRs. They don't necessarily allow smaller things to purchase or be a part of their ecosystem equivalently. So that's just literally not an option. But the other thing is, if you look at the private market, when we see like Function Health is something that we always track as like this unicorn that 3 years old and is over $1 billion value. I secret shopper everything in this market. And so I went to get a function lab test, and I can tell you that like that morning in the room of 6 people waiting at Quest Diagnostic to get a lab drawn, half of them were there for function health. I could tell just based on the demographic of it and stuff. And so like saying that, hey, we have to have something that's fully integrated in our hospital EMR to participate in as a precursor before we even consider participating in the premium diagnostic market like function health basically says, sorry, we don't do that. Like that's it precludes you. In other words, like if you have that bar that everything has to be there, you just might as well not start. You're just never going to even keep pace with anything, let alone, I mean, again, we work with large healthcare systems, like healthcare systems accepting payment. Like you could build something online with e-commerce tools that are ubiquitous in the market if you were just an independent person trying to sell, I don't know, you're just trying to help. My son got into crochet at school. He's like, "Oh, I'm going to sell these hats." I'm like, "Great, we could have a Shopify store in 10 minutes stood up, right?" That would take you 3 years and the equivalent of several $100,000 of contracting people's time to do that at a healthcare system. And that's where we're at, right? Like the bureaucracy we've built and protections for all these things, because they have to be so high in terms of SOC 2 compliance, high trust, HIPAA, let alone PCI compliant. It's just burdens that the rest of the market doesn't have.
Yeah, it's a very complex market is like the very simplified term to describe it, trying to navigate it. So, and
Yeah,
then
it actually kind of puts us in this unique place where we're the only ones trying to, I think, right now, we're, I think, fairly unique. We're trying to bring the premium market and the health system market together. I think everybody who is in the world of the premium market tries to avoid health systems like the plague. So I think either insanity or silliness or stubbornness, we're trying to say, hey, again, back to those first principles. It's great to do the premium market. I think a lot of people are doing it really well that we admire. It's just that, like, okay, but to hit the masses, you got to go through these healthcare systems. You got to evolve them, and so we're trying to just committed, right, wrong, or indifferent to doing that.
yeah, absolutely. And then we kind of talked about a little bit kind of tertiary, superficial level, but what's working well for you right now, and like what's been frustrating as you're kind of going through things?
Yeah, I think again, trying to get people off the sidelines and moving on these things. I think a lot of people we've talked to have a lot of interest now in this market and the need to offset a lot of the budget cuts and other things. So anything that, again, we're very unique. We say, hey, we're the first vendor that's going to pay you. Like we will help make you money and go to market with and for you. I think so. Both things. So the thing that I think is that has resonated and is we're very happy with is I think we are, by our very nature, my background, we are health system people, right? So we're not like, young kids on ramen, got an AI bot from Silicon Valley and telling healthcare systems, you don't know what you're doing. Let us do it for you. We're saying, hey, I've been inside of health system. I was responsible for innovation with an unlimited budget and I could barely get anything done. It's just not what you're built for. But you know what you do have that is like so incredibly difficult to replicate is a brand name that has trust and quality and has decades of expertise. Let us share in that. Like you don't have to, that doesn't cost you anything. Like you provide that, we'll bring everything else, the providers, the tech, the marketing. Let's put those two things together and therefore we should share in the upside. We should build that and go to market together. And so I think that's resonated, but then it's the quickness, like, okay, well, great. I think a lot of people agree with that. They're like, oh, we don't have time to, like, again, if you were to say, hey, we're going to enter the concierge market, okay, we'll spend 2 years recruiting a doctor, building a building, and seeing if this one doctor works out, and it'll be 5 years, and then we'll shut it down, which is almost always what happens. That's not even a fair shake to the market, right? Like, we can be live in 6 months, and frankly, you already have all the assets you need. Let us do it digitally, virtual first care with a significantly upgraded tech stack that really makes it feel like concierge, not just a nicer doctor, but like I can self-schedule appointments. I can see all my lab results really smoothly. All the things that the current systems don't give you. And frankly, again, I can buy it and I can add my spouse or I can cancel anytime I want. Those types of things are just the clunkiness that healthcare's not good at. So we try to bring that partnership together. And I think the frustrating part is just we want to move faster than a lot of health systems. And we think we built a model where they don't have to do a lot. They just need to make the decisions. But surprisingly, decisions get, not surprisingly, I guess, is decisions get super analyzed in healthcare systems. This is part of the challenge is healthcare systems operate in a way that has a lot of decision makers. And I think that they need to recognize like, hey, when there's a low cost and there's a high upside, let's just let two people sign off on this and get going.
Yeah, move forward. Exactly. And then like I'm also interested like the data analytics side. Like how do you measure like your KPIs or your metrics like as you're growing? How do you know that you've been successful?
So we try to keep this very simple. I think one thing that health systems do, and frankly everybody does, is with the abundance of like so much data and
Yeah.
and the proliferation, I think we get lost in analytics for analytics' sake. I think we have a very clear true north. We need to delight patients, and you know how we'll know if we're doing that? If they sign up and if they stay with us. And so the metrics that we want to provide as top line are very simple. It's like number of registered patients, number of patients retained month over month, and then of course the quality standards. But those are pretty I mean, this is primary care. We're not doing anything magical. There are things around like antibiotic stewardship and lower back pain protocols and HEDIS measures and all those types of things. But again, that's where we rely on the health system to tell us like, hey, what do we need to be measuring and monitoring for quality? What protocols do we need to use? and they contribute that and it costs them nothing. But it's valuable for us because it helps us piggyback off that trust and that brand equity that they've built, spent decades, and then we regard very highly. But I think that the metrics, I try not to make it more complicated than that. Like, I think often we're like, oh, we want to study that. Look, we can get into cool like engagement and AI use cases, but engagement's a good example of like, what does that mean in healthcare? I think having an app that you go into every day, I always, my product lead and I get into this every so often. Like, I wish there was a good way to say if you have engagement in an app, that means you're really committed to that. But the reality is, like, if you're doing well, we don't need you in the app every day.
Exactly.
It's never gonna be Duolingo. It's never gonna be like something like, oh, I was enticed into, a streak with my spouse and me. We're competing to see how many days we can learn Spanish. I mean, that's fine. That's just not what healthcare is, right? Like, nobody wants to just be like, oh, I'm gonna do healthcare facts every day. And the reality is, we want to figure out what are your goals. And this is, by the way, the funny thing about everything that we've learned about deep consumer research is that what patients want out of their healthcare, unfortunately or fortunately, like, we're not moral judgments here, is concierge care today. The top things that people are looking for is, I don't want to feel rushed. I want the same provider repeatedly so they can get to know me and my family. I want timely appointments, and I want to be able to, feel like that's a good experience where I'm being listened to. And I'm like, you can't do that with a panel size of 3,000 patients and 10-minute appointments, of which you're 5 minutes, 20 minutes late for, right? Like, you just can't do that in traditional primary care. But that is, if you had to define it, which again, there's no standard definition, that's the mission of concierge cares, right? Like, I want to give John a dedicated doctor who knows him, has 30-minute appointments, so nothing feels rushed, has same day availability. Whether you move or the doctor moves, we can still actually maintain that relationship because it's a virtual concierge. Those are the types of things that we just think are what people want. They just happen to be in the premium market. And then I think the thing that shocks everybody is that 25% of the market would pay $100 a month for this access. It's way more ubiquitous than people think when they think of like who's willing to pay for a concierge doc. But that's assuming you can bring the price down, which we can. Like, most concierge in this country starts at $3,500 a year, which is a much smaller market than if it's $100 a month, then it's actually quite a larger market.
Yeah. More affordable for people to get that experience that they're looking for, like not to experience like double, triple bookings and the doctor's stressed out because they're 2 hours behind in their appointments.
Yeah, I mean, have you ever? I don't know if I've tried to talk to a doctor about like I remember my last in-person PCP, and unfortunately I remember it because it was great. It's like, okay, I'm here. It's like, okay, great. What are you here for? I'm like, nothing. I should have an annual checkup, and I've been trying to lose weight on this keto diet. He's like, what are you here for? I have like 15 diabetics to get to today. Can you? Basically, he was like, can you get out of here? Like, this is not a good use of time. Like, go read a book about keto. So there was no engagement on anything proactive because he had kind of settled into a practice where he was just going to be like, look, it's sick care or nothing. There's nothing proactive. There's no wellness focus. And there's definitely, unfortunately in this case, I'm not generalizing here, there's no interest into saying, John, what do you care about? What are your goals? What are you trying to do with your health? What's an outcome you want to see in 5 years? And it could be just to maintain, but like, what is that answer? So I think we need to build a model that allows for that. And that's, again, no knock on the doctors. It's just the reality of the system they've been built to work in.
Yeah. Unfortunately, it is. And then, like, if you're looking down the road, like future, if you're an oracle, I guess is the best way to describe it. Where do you want to be 6 to 12 months from now in your business?
The biggest thing is we want to have proven that this works and it's simple and it's scalable and it's not that complex, but there's just not a lot of people doing it. And I think so what that looks like is getting live with clients right now. We are working with some healthcare systems where we're supporting their memberships. We are getting live with others where we will do all of the clinical services. And so I think we want to keep it very simple. So 12 months isn't a lot in startup land, but in 12 months, I want to say that like this is a great, like the platform is the nicest consumer experience you can have. The quality of the care is great. And when we invite patients to try this, that we have a backlog of thousands of patients. And therefore, we're making our health system partners a ton of new revenue. We're offloading patients that are willing to pay for a higher premium experience into one that they still bears their name and is coordinated with their care and their facilities and all this other stuff. And that everybody's happy. The patient's happier to have a better experience. They're happy to pay. I mean, that sounds crazy, but they're happy to pay. And that health systems are like, wait, this worked. And it didn't it didn't have to be we didn't have to spend 12 months integrating it into Epic first or something. Like the silly little things that it just, everything Awesome said would happen is what happened. That would be a great place to be.
Yeah, that would be a great thing to achieve, just to make it digestible on both ends, like for the patient and the providers, because by providing that concierge service from what you're describing, it would offload a segment of patients in this other channel to make it so you could actually make the appointments longer on both ends technically, if it's truly working. And
Yeah, we often get asked what is the angle for this for health equity,
yeah,
or how does everyone get to benefit from this? And I'm very blunt about it. Look, you need to make money to be able to even have a chance at your mission, right? We're not trying to knock that. We're just acknowledge what our role is in that. But to be very blunt, let's make this up. Just use round numbers. If you have 10,000 patients today that are seen by these number of docs in this clinic, 1,500 of those would be willing to sign up for this today. Imagine if you got 2,500 spots available for the general population, because you don't have to add docs, we'll bring those, and now you're increase the revenues from these. They get a different level of experience that they've paid for access, but you also get back all of those spots in the traditional primary care one. And that means that you don't have 5-month waiting lists. You don't have, 9 months to see a specialist kind of thing. And everybody can win on this as long as we don't like turn it into something that it's not, which is just saying like, we'd love to bring the price down even further as we grow and other things. But the reality is like right now, again, there's this massive untapped premium market that we believe health systems have to look at if they're going to be a viable solution to commercial patients in the future, which are demanding these things.
yeah, absolutely. And you're just speaking to the market. Like as a patient myself, I've seen this as well. It's nothing new. It's just like you haven't seen like a market disruptor yet who's doing that out in the health ecosystem, saying, yes, we're going to fix this. And this sounds like it could be one of those things potentially. So,
Well, I think so. By the way, there was a earlier version of this, and this is honestly where it came from. So, One Medical is known a little bit more ubiquitous in the market, not in every market, but definitely East Coast, West Coast, and starting to enter new cities. But the problem with the One Medical is like it's a great deal, especially now that Amazon's subsidizing it for the patient. The problem is everyone else loses. The health systems are losing a ton of money on it because they're subsidizing it. They're not making money off of it. The employers who pay for One Medical are also losing a bunch of money because their healthcare costs have not gone down in any way. They've just added this premium service. And now the funniest thing is like Amazon is losing money because it was always purchased as a loss leader for other parts of their business. So you can give a great deal to patients if everyone else loses money, but that's not sustainable. I mean, that's why we're seeing people second guess this and being like, hey, why are we still in this contract? Because financially it was built on like, let's everybody subsidize a slightly, well, actually it's an elevated, I'm a One Medical customer, it's an elevated patient experience for very low cost, but that's because again, everyone else is losing money in the mix for it, and that's not sustainable as a systemic solution.
and just kind of getting to the end of our podcast here. If you could solve one major challenge today, I always use like a magic wand as an analogy, like what would it be? Some like no barriers, something you could fix right now.
I mean, so my premise is the one that obviously I see the most right now. I think it would be to have every healthcare provider in the country compete on experience. And I'll just qualify what I think that means, because I think this is where healthcare gets mired in all of these semantics that are lost on patients. So one, providers will be like, no, we're a quality provider. I'm not worried about the patient experience. That's the same thing to patients. You say quality and you're hearing words, or you're saying that word and you're hearing things like gaps in care or the number of patients that receive antibiotics for upper respiratory. You have all these metrics inside that you think dictate quality, but the patient doesn't know any of that. The patient's like, how bad was parking? How late was the appointment from when it should have started? Did the doctor apologize if they're 45 minutes late? And then how easy was it to get whatever I needed next, whether it was, by the way, how easy was it to make this appointment? And obviously, if you ask the doctor, like, I don't know, that's not my business, like, I don't do the technology, but like, it is part of the comprehensive experience and it translates to quality, because I think healthcare systems, for example, they're always like, oh, well, if it takes too long to click the buttons, just imagine how many people are not getting an appointment because they know they have to call you. Like, just the amount of underutilization because they're like, oh, I don't have time to call on my workday, et cetera. So I say experience as a proxy for everything: quality, experience, and cost. Again, the cost of healthcare has a huge implication on patients' view of the experience. If they were like, hey, that was great, the appointment started on time, they let me book it online, it was amazing, this or that. Oh, but then I got a $500 bill in the mail 2 months later. They didn't have a great experience overall. So, like, again, if we compete on this experience overall, just like every other market, I think it will change the dynamic in healthcare. And right now, we don't. We just think that there's all this bureaucracy that controls things, and patients don't make their own choices. I mean, I think that's unfortunately a fundamental belief that goes unsaid in this industry, and I hate it. I hate every part of that assumption. And parts of it are true, by the way. I mean, I'm not denying it. I just hate every part of it. That's what I'd like to change. If I had a magic wand, I would change that, because I think then that would trickle down into cost, quality, and in actual meaningful ways to patients.
Yeah, and I can see how that would happen. Like if it was more systemic, like it would start with one organization showing the model as like an example, like, hey, they did it. This hospital is a similar size. They have a similar patient population. We even did this across, like maybe in the UK. If you're going internationally with other organizations, it could be a worldwide.
Well, I'll give a silly, a seemingly trivial equivalent example, but like
Yeah,
if you order anything online today, how long do you expect it to take to get to you? What's your expectation when you're buying it?
within 24 hours. That's the best experience.
If nothing else, 2 day shipping, right? And that's
2 day
not because
shipping. Yeah. Yep.
and we all know why is that? That's because Amazon set that
Amazon.
standard with
Yep.
Prime, right? And that's just it. I 100%, and then that's why like Amenities is a venture-backed technology startup, but it's also my thesis on how to fix something in healthcare, which is the point is the flywheel, right? Like if as long as some major health systems start to do this, everyone and it works, then everyone else will say, "Ah, crap, we got to do that too, just to keep it alive." And that's when I say rising tide, all ships here. Is that like if you start competing on experience, everything will start to get better. Is my hypothesis. Now, what I'm trying to do is then say, how do I get healthcare systems financially excited about competing on experience? And that answer is the concierge premium market. Get them participating to offset these other losses in a way that now, crap, I tricked them into also competing on experience, and now everybody's got to do it.
Absolutely. Well, thank you for your time today. I really appreciate having some great conversation and really fresh perspective on how to approach healthcare. And I think you're really on to something great here. So thank you for your time.
I appreciate it. Thanks for having me on. It was a pleasure speaking with you.
Absolutely. And where can people find you at, like digitally, like online, and how can they
That's
connect?
amenitieshealth.com if you want to see what we're doing, what we're building, and how it works for different healthcare players. Typically, large healthcare systems, also large medical groups that have a patient population that would be interested by this. And then I'm on LinkedIn, Sim Saeed, easy to find. You'll see me, AASIMSAEED. Or if you want to drop me a line, awesome at amenitieshealth.com.
Excellent. Well, thank you for your time today. And I'll be excited to share this with my audience. So thank you for your time.
Pleasure.